Hello and Assalamu alaikum. Ultrascan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the lower right 5 for the graft and implant evaluation and lower left 7 for inferior alveolar nerve evaluation. Starting with the lower right 5, this is the transaxial view. As you can very clearly see, the implant is placed quite center of the ridge, and we can see it right here. There is considerable lingual plate present on the on this aspect, that you can see right here, and we've got a considerable graft present on the buccal aspect. So we've got the buccal aspect very well covered by the graft, and the implant at no point is exposed. So this is, even though this was an extremely thin ridge, the implant is placed dead center with absolutely no problems here. This is the axial view. As you can see very clearly that we've got, this is the crest of the ridge. As you can see, it's all grafted. Then comes the implant, very well grafted, and you can see bone on the buccal aspect here. And throughout this axial view, you can appreciate this excellent bone covering all the aspects of the implant very well, with no periapical bone loss can be observed. Moving to the lower left 7 and its relationship to the inferior alveolar nerve. There we go. So this is the lower left 7. I'll just turn the angulation to get a true cross section. So this is the lower left 7. We've got a considerable periapical infection here and the distal root. Then moving to the mesial root, again considerable infection. To understand the distance from the apex of the distal root to the inferior alveolar nerve, we've got an approximate distance of just 2 millimeters, and there is a periapical radiolucency, so this needs to be grafted and bone augmentation needs to be considerably done. At one point, you can actually see that there are feeder vessels right here which are coming out and supplying the granulation tissue and in the periapical region. So this is definitely an area where extreme bleeding will be done. So it needs to be kept in mind. Thank you very much.